Hi, everyone. I just wanted to come on here and kind of do a review of the lab exercise with the skull. Um, just because a lot of people who have turned it in thus far have been getting them wrong, and I just want to make sure that you're aware of these parts of the skull. They are from your lab list too, and these will show up on your next lab exam. So, to kind of start here, we have these labeled skulls in multiple views. This is an anterior view and a lateral view, and we want to just know what bones are present here. And so if I look at number one, this is going to be my frontal bone, okay, covering the frontal lobe of the brain. If I go to number two, this is my upper jaw, but the upper jaw has a scientific name, which is maxilla. Number three, these are my cheekbones. Your cheekbones are called your zygomatic bones. Number four is the lower jaw, which is called the mandible. And remember, for your lab exams, I'm asking you for words based on your lab list. So do not give me the common name for these bones. I am looking for its scientific name, and I'm only going to ask you bones that are, or bone landmarks that are from your list. Number five is the nasal bones, and that is their name. The majority of your nose is actually cartilage, but right up here, kind of at the bridge of your nose where you might place your glasses, number five is the nasal bones. Number six, moving to this skull. So we have frontal bone here, but number six is parietal bone. And this is just showing one side, the right side, but there is also a left parietal bone. And then going past here, we have number seven, which is going to be part of your occipital bone. And of course, it will go much further underneath the skull on the inferior surface. Number eight, from that lateral view, we can recognize it because we see the ear canal, your external acoustic meatus. This is the temporal bone. And there'll be one for each side. And then 9 and 10, it gets a little dicey in here. So we've got a few structures. So we've got this one that's kind of like a lightish yellow green. And then this one is actually green right here. What 9 is pointing to is going to be the lacrimal bone. And this is the right lacrimal bone. And I recognize it because it's got the tear duct going through it, the nasolacrimal canal. That's that little dip. Behind it would be ethmoid bone. And then what we can see in this yellow here, much larger, is an internal cranial bone, which is sphenoid. So that's kind of the labels for this picture, okay? Just showing some basics. We haven't even gotten into any landmarks, so parts of these bones that are on your list or foramina, holes in these bones. So let's move to the next picture. This one still is not really even doing landmarks per se. It's still looking at bones, but this first section is looking at sutures, 1 through 3. So our first suture here, okay, is your coronal suture. Kind of at the crown of the head. We also have one that is splitting, or not splitting, but rather connecting the two parietal bones here. This one is going to be sagittal suture. And then the one in the back here that kind of dips down on either side, connecting what we see in here would be the parietal bones to occipital bone. This is lambdoid, um, or lambdoidal suture. I don't think it has a B in there. It might. Apologies. Let's fix that. There we go. So these are sutures. We will learn in future chapters that sutures are actually joints that combine your skull bones together. When you're born, your skull bones are not fully fused together, but as you grow, okay, and reach the stages of being a toddler, you form these sutures, which are permanent joints between these bones. Looking into the skull from a superior view, once the skull cap has been removed, we can see a few bones on the inside. Number 4 would be the ethmoid bone. also seen up here on the side in this green. Number 5, still in the yellow, is your sphenoid bone. And then number 6, okay, in the blue, and this is what we're looking at internally, this is going to be your temporal bone. You can relate it back up to here as well as you study. Now, these are all pretty much, aside from a couple facial bones that we see in here, these are majority are cranial bones, okay, that we've gone over for this section. And then this is the harder part. We're starting to look at landmarks, and I haven't done any of the processes or certain features that you do need to see as landmarks, so make sure you check your list, okay, and you're studying those. And you'll be seeing a video coming from the TA, Ryan, right, who's going to go through all these structures. But we're going to just start with this assignment by looking at the foramina, or the holes in these skull bones, okay? And so some of these actually from this picture that had pre-labels put on it, so 5, 8, 11, and 12, you don't actually need to know because it's not coming from your lab list, okay? So don't worry about those. But we do have some that we can see. So right up in here, I know that this is sphenoid bone here. Lots of foramina found in sphenoid. And right up in here, okay, most superior, we see our first 2 holes labeled number 1. These are going to be your optic canals, right? So they'll follow through and kind of come out in the eye. Number 2, we still have an area where we will either have nerves, right? So optic canal is going to have part of your optic nerve going through it. But then where your eye actually sits in its orbits with all those blood vessels and other things coming through, we actually have orbital fissures. So number 2 is superior orbital fissure. And we can even look at it from another view. Okay, I want you to know these from multiple views. This assignment is just supposed to get you started in your studying. But if I go back up here and say I look at the skull head on, I'm going to look in the orbits, the eye sockets. These 2 small holes here are part of optic canal. And then this wider kind of hole is superior orbital fissure, and the lower one is inferior orbital fissure, right? All of those are on your list. But you can see these are from multiple views. Number 3 is going to be foramen, so it actually has the word hole in it, rotundum, this tiny guy here. And then typically when I am looking at the skull, I like to start in the center. There is a mnemonic that you can kind of do with this, and I'll draw it. So I'm looking at this one, and this one. And kind of how I learned it, this is spinosum, foramen spinosum, foramen ovale, and this is foramen lacerum. And again, lacerum is on your list, but it's not one of the ones that we have an arrow pointing to, at least for this assignment. But if I go with the first letter of each name, it's S-O-L, right? And you can abbreviate that however you like as a mnemonic, right? But typically, if I find these 3 holes first, kind of just making that rainbow or arch shape, then I'm able to find the other ones in the skull as well, okay? And so number 4 is pointing to our middle one here, foramen ovale. So I'll go ahead and type that. So number 4 is foramen ovale. Number 5, do not worry about. Okay, we'll talk about this one potentially later in the nervous system, but it is not one of the foramina you need to know for this lab exam. We'll switch to number 6, okay? Number 6 is a bit farther down, and you can see that one side makes kind of this J shape. This is your jugular foramen, seen on either side. These are often paired because they have paired blood vessels or nerves that go through them. Number 7 is the largest foramen or hole in the skull, and it is aptly named foramen magnum. Just means large hole. Number 8 is also one you do not have to worry about, so we'll just skip that one and move to number 9. Now, number 9 is not part of our SOL, okay? But we do know that number 9 is attached, you won't really see it, but through the bone, there's a canal, and it's attached to foramen lacerum. And so number 9 is actually our carotid canal. We then move on to number 10, which is part of our SOL. So this is foramen spinosum. Number 12, number 11 and 12, we don't have on here. I am not sure what they were trying to point to on this, or when I took the picture, if it was just had labels and they didn't make it over. But then number 13, you could just name this the ethmoid bone, right? Or we might want to name the specific landmark that it's pointing to. We know this is the ethmoid bone, which kind of sits behind the nose. So if we kind of look in the skull here, ethmoid bone, this light green, ethmoid bone, light green. And there are some points of the parts of the ethmoid bone that you do need to know. It's on your list, but we're pointing to kind of the porous area that is on either side of this other structure in the center. The porous area is called cribriform plate. It does have holes in it. It is going to be where your olfactory nerves are going to go through for your sense of smell. And cribriform plate is aptly named. If you ever go to Cracker Barrel and you sit at the tables and you get the game that's on the table, which is like a triangle made of wood and has a bunch of holes in it, that game is called cribriform. And so cribriform is referring to the amount of holes that are in this structure on either side for the ethmoid bone. So those are the answers to this assignment. Hopefully that is helpful. And then when you see Ryan's video a little bit later regarding the bones, and this is not just going to be the skull, right? You're going to have other assignments involving other parts of the body, other bones, but the skull is especially difficult. So I wanted to make sure that I went over this with you guys. All right, thanks.